Welcome. In this lesson, we'll begin our exploration of Measure Workshop. We'll define the denominator and numerator parameters of an event measure with one of the many measure templates available in Ursa Studio. From the Measure Workshop home screen, we'll begin to create a new measure by selecting the plus sign icon in the upper right-hand corner of the screen. You'll be redirected to the Measure screen, where you can select a measure template to use for creating a new measure. Measure templates are based on common measure archetypes. And as you can see, we have quite a few of these to choose from. We are going to create a measure that tracks the percentage of ED visits following a hospital discharge. To do so, we'll use this event D followed by event N template. When selecting an option from this dropdown, the associated template appears, and now we can start working on completing the specifications for the measure. The first section, as titled, is concerned with the denominator, and the first field requires us to define the denominator object. You may remember from previous lessons that objects are database tables or views, and they're associated with metadata that Ursa Studio uses to track and manage the table or view. So this first field, event D base object, is asking for the object that contains the data associated with the denominator event. In this case, we can specify SO Ursa, claims-based hospital inpatient admissions, as the denominator object. This object contains one record for each hospital inpatient admission. Once I select the object, the next few fields are auto-populated. This occurs because the system recognizes the fields as likely correct choices due to their utilization of the Ursa standard naming convention. Now we just need to review each of these pre-populated choices to ensure that they make sense for this particular measure. Event D case ID is looking for the field or fields that uniquely identify the denominator event. The system correctly inferred that encounter ID is the correct field, but if needed, we could simply overwrite this default and select a different option. Event D entity ID is looking for the field that uniquely identifies the measure's entity, which in this case is the patient. This is a field that must be common to both the denominator and numerator objects. Again, the system made the correct inference of patient ID. Remember the concept of report segments that we discussed in the previous lesson? The event D effective date field is where you'll specify which of the columns from the denominator object the system should use to assign observations to the reporting segment. In this case, the system suggested we use the admission date, but we're going to select the discharge date instead. Finally, the event N timing window start date field is where you specify the date field that should be used to trigger the timing for the numerator event that's being evaluated. In this case, it will again be the discharge date column because the measure is looking for ED visits within 14 days of the patient's discharge from a hospital stay. As you can see, that's all we need to do to specify the denominator's parameters. Next, we'll define the numerator's parameters, starting with event N's base object. Here, we'll select the object that contains the numerator events that we're interested in measuring, which in our case is SO Ursa claims-based ED visits. Again, Ursa infers the likely options for defining the measure's numerator. Next, we can verify that the event and case ID option is correct. This is the field or fields that uniquely identify the numerator event. Ursa's inference was correct. We do want encounter ID. So let's move on to the next one. Now we'll specify the event and entity ID option, which for this and many measures is the patient. Again, there's nothing we need to change because the system has already inferred the correct field. The event and effective date option is, as you probably already guessed, the date of the ED visit. The event and timing window length option gives us 2 tracks that we can follow. If the measure you're creating has a fixed number of days between the denominator and numerator events, then you can select window length of X days and enter the duration in days. This is the option we want for this measure because we're interested in ED visits within 14 days of discharge. However, if we were interested in a scenario where the measure does not involve a fixed number of days, but instead is interested in the duration between 2 dates contained in different fields, then we would select the Window End on Event D Date property option and enter the date field. Last, we'll define the Event N Ordinality option, which defines which instance of the numerator event within the timing window we just defined is the one we want the measure to consider. For example, the measure we're defining could possibly have patients with 2 or more ED visits following the hospital discharge, but we want the measure to count the first one. This option allows us to specify that requirement. By selecting the choice that allows for the first instance of the numerator event to be counted, we ensure that that requirement is met. We just reviewed how to define the denominator and numerator parameters of an event measure using the event D followed by event N template. In the next lesson, we'll complete the template and add the measure to a report so we can see the measure in Analytics Portal. Thank you for taking a few minutes to watch this lesson. I'll see you in Measure Workshop Part 2.